Are you suffering from sciatica? Have you been relying on pain medications to get through each day? Have you visited the doctor recently for an injection? Have you had an MRI or an X-ray to see what's going on inside your body? Or maybe this is the first time that you're looking for help somewhere. My name is Dr. David and I'm a specialist physical therapist at Paso Manual Physical Therapy, and we specialize in helping people suffering from sciatica get back to being healthy, active, and mobile again while avoiding unnecessary surgery, injections, and pain medications. If you're looking for a specialist to help you with your sciatica problem, then you should consider signing up for a virtual consultation with a specialist physical therapist to help you recover from this problem for the long term. You can learn more about booking a virtual consultation with us by clicking the button right below here. Now, if you're looking to learn more about how sciatica affects people, I'm going to answer the 3 most frequently asked questions that we get by our patients here in the clinic, as well as online on our YouTube channel that has over 100,000 subscribers. The first frequently asked question we get is, what should I avoid if I have sciatica? There's 2 main categories of activities that you should avoid if you have sciatica. 1 is stretching activities, and 2 is activities that put pressure on the sciatic nerve. And for stretching, let me break that one down for you. People are often told to do stretches when it comes to sciatica because the idea is you're stretching out the muscles around the sciatic nerve. And that's good if you can isolate the muscles, but it's pretty near impossible to just isolate the muscles when stretching and not also stretch the sciatic nerve, because aggravated nerves don't like to be overstretched. They actually shorten a bit, and when you go to stretch them out, it's going to make them worse over the long term. It might feel good to do a stretch in the short term because those tight muscles are loosening up, they're freeing up, but you're also aggravating the nerve, and that's going to keep making those muscles tight in the future. Let me show you some examples of stretches that people do all the time for sciatica, and I tell them to avoid these in the short term at least. The figure 4 stretch is very often done. It's where you cross a leg over this way and then you're pulling your other leg towards your chest to stretch out right in here. It looks this way from the other side, pulling your leg over this way. Reaching towards your toes like this is another stretch that's often done to stretch this part. And a secret way that people stretch, it's not a straightforward way, but going on walks in order to help sciatica actually tends to make it worse, because when you're walking, you're moving one leg in front of the other, you're adding a low level, consistent stretch to your nerve every step you take. So if you have sciatica, it's actually not a good idea to go walking in an attempt to relieve it. And it's especially bad if you're trying to walk taking big long strides, because then you're putting even more stretch through that nerve. The second category of things you should avoid for sciatica is putting pressure on the area. So things like self-massage, like if you dig in there, pressing in there, going to go get an actual professional massage or having somebody at home give you a massage. Those activities, if you're pressing on the actual nerve, you're going to aggravate it because it's already irritated. And if you press on something that's irritated, it just irritates it more. The reason why it may feel good in the short term is because the sciatic nerve, especially right here in the back of the hip and thigh where most people get their symptoms, it's surrounded by muscles that also get stiff. And so the idea is to push through the muscles to get the muscle some relief. But if you don't know what's a muscle and what's a nerve with certainty, you might actually be making the sciatica problem worse in the long run while feeling some short-term relief from loosening up the muscle. So this is a deceptive relief that you're getting, because you may feel relief in the short term from relaxing the muscle by putting pressure on it, but you're also pushing into the nerve and keeping the problem there for longer. It's going to make the muscle want to stiffen up again. Using massage guns like this one, using it to pound through the area is also not a good thing, because you're putting pressure on the area. And a third category that I don't always talk about for aggravating sciatica or any nerve symptom is vibration, which is exactly what this gun is doing for you. So things like this are not good if you have sciatica. The second most frequently asked question is, does sciatica always require surgery? The answer to this is no, absolutely not. In fact, if you go see a surgeon for your sciatica problem, they're going to be focused on looking at your lower back, the spine, and the nerves that are coming out the sides of your spine to see if there's any compression on those nerves from your spine. It may be from a herniated disc or arthritis or some bone spur, something that's putting pressure on the nerve. Stenosis is another one that can often cause pressure on the nerve and can create sciatica symptoms. But it happens very often that we see patients that have gone to go get an MRI and the surgeon tells them, your MRI looks great, the nerve is open, I don't know why you're having sciatic pain, it may be something in your hip or something else, but I can't help you. They'll say that because what the surgeon is looking for is something that's structurally not right that they can go in and modify or operate on and clear up pressure on the nerve. But the reality is that sciatica is multiple problems that have all come together, and the spine is just one area where a potential problem can happen to the nerve. Very often there's issues in the hips, the pelvis bones, even down into the thigh, the knee, and the foot. And if those issues aren't addressed, then your sciatica problem isn't going to get better. We have seen so many patients over the years that have had a spinal surgery because of their sciatica problem, and they're very disappointed because their sciatica problem is still there despite having gone through the surgery. And they proceed like this for years very often, and then we see them here in the clinic and correct the hip and thigh and foot problems they're dealing with that are really the root problem of the sciatica, and they get better, and then they're questioning themselves on ever having that surgery to begin with. So you don't always need surgery. In fact, it's rarely the case, and it's only if you have real obvious findings on your MRI that your surgeon can confirm they can operate on. Now, question number 3 is, how can I fix my sciatica for the long term? Well, you've got to fix the muscle imbalance. There's usually a huge muscle imbalance that has allowed the pelvis to shift. And let me show you on the skeleton. The muscle imbalance causes this pelvis bone to shift either backwards or forwards or upwards, sometimes downwards, even inwards and outwards. And when that shift happens, the sciatic nerve pops out right here and it can compress the nerve. And that's what usually causes the pain in the rear end back here that can go down the thigh. That's classic sciatica symptoms. Now, the surgeons are looking at these nerves up here because they bundle together and pop out as a sciatic nerve right here. But if your MRI is clear or there isn't anything obvious going on, maybe just age-related changes, then more often than not, the issue is here. About 80% of our sciatica patients need to get this pelvis muscle imbalance addressed in order to get long-term relief. And then the other 20%, we're looking down into the leg and into the foot. Now, the problem with fixing the muscle imbalance is that not many healthcare providers out there are trained in identifying and treating the muscle imbalance. Surgeons definitely are not. So most people with sciatica problems are just going to the wrong healthcare professional to get help. They're going to the professionals that are going to recommend medications, injections, and surgery. And most physical therapists also aren't prepared to handle this because it's a specialty within physical therapy that knows how to handle this in order to prevent surgery. Most physical therapists are trained in helping people after they've had a surgery so they can get back to walking and doing things normally. But if you've not had a surgery recently for sciatica and you want to make sure you don't get one, then seeing a specialist who can help you avoid surgery, medications, and injections is the best way to go. And fixing the muscle imbalance takes doing the right exercises at the right time and in the right way. And this is why physical therapists generally have an idea of what exercises to do, but very often they're doing it the wrong way. They're emphasizing the wrong muscle group, and they're doing it at the wrong time in the process of healing, because at the very beginning there's certain things that need to be done, certain exercises, and there's exercises that will be good later on to do, but they shouldn't be done at the beginning because they're actually going to be too difficult and aggravate the sciatica problem. But once you fix this muscle imbalance, then the bones will usually shift into the proper position, and then you're helping yourself prevent the problem from coming back again, because that's one of the problems that people with sciatica face, is it flares up and then they relax, they stop doing as much, and then it flares down, but once they get back to being active again, it comes right back, and they're in this cycle of it comes back, it flares up, then they take some time off, relax, and then it flares down, but then once they get back to being active again, it flares up. And so weight management's an issue, staying healthy, staying fit's an issue, doing life normally becomes a problem because people know that there's going to be problems if they do too much of a certain thing, like exercise or chores around the house. Now, our clinic specializes in identifying this muscle imbalance and treating it and guiding people on how to do it themselves. So if you're interested in a virtual consultation where we can help you find out which exercise to do and how to do it exactly and how to progress from there, then you're going to want to hit that button down below to learn more about booking a virtual consultation with us. Now, if you're not ready to book a virtual consultation, that's completely fine. We understand, us being online, it might be a little bit strange, but you can also request a call back if you just want to learn more. So once you hit that button there, you don't have to book a virtual consultation. And the request, by the way, you're not going to see a scheduled time. We'll call you back anyway to do that, but some people want to go ahead and pay for it and get it set up, and then we'll call and set up an appointment. But if you don't want to pay anything right now, totally fine. You can leave us your details on the form on the bottom of that page, request a call back. Somebody in my office will give you a call back, answer all your questions, and make sure that we're the right people to help you so that you don't waste your time and money. And then if it's right for you to book a virtual consultation with us, they'll go ahead and take care of that with you over the phone if you're ready for that. I sincerely hope that you can get over this sciatica problem and get back to being normal again as fast as possible so that you can do all the things that you love to do. I hope to talk to you soon. Bye-bye.